Hello and welcome to Long COVID Foundation podcast. This is the channel where we share educational information on long COVID to help you understand your symptoms better. So if you want to learn more, please watch this talk from start to finish because it will help you to learn more. And just very quickly, if you're new to the channel, make sure you hit subscribe button because I can help you to get answers relevant to your symptoms. And don't forget to give a video a like because this tells me that these videos are helpful and at the same time it motivates me to create more content for you. Drop in the comments what are the most worrying symptoms you have experienced with your doctors, and we together will try find solutions. Thank you very much, and let's get straight into our interview. It's my pleasure to welcome Dr. Marek Fabrowski to our channel. Marek is general practitioner and practicing in the UK, and at the same time, Marek is a long COVID sufferer. So I'm pleased to say that Marek has recently joined the foundation and dedicates his time to understand the pathology of this disease and help same-minded sufferers globally. So Marek, thank you very much for being with us, and it's such a great honor to have you on our channel.
Well, thank you for having me, Valentina.
So today we'll try to cover several topics, including the treatment you currently undergo, testing solutions that help people to understand what are the real causes behind these diverse symptoms people have, and also discuss whether it is hard to get these tests in the UK or in any other country. So first of all, please share your story and where you are now in terms of your long COVID recovery.
Okay, so I'm a doctor in the UK. I'm a GP. I also work in A&E. In March 2020, I had a 5-day flu-like illness. I used to run a lot. I used to be relatively sporty. But after this 5-day illness, I just didn't reach 100% again. I was maybe functioning at 80, 85%, but just cracked on. It was the pandemic. It was sort of March, April 2020. I just cracked on with things. October the 31st, 2020, I started to have chills, breathing difficulties. My heart rate was 170 at rest. And for a regular adult, a heart rate of between 60 and 100 is normal. So I was quite concerned. I had severe headaches. I had shakes as well as sweats called rigors. I had odd sensations, so paresthesia it's called. And I felt that I couldn't move my left hand and my left foot, for example, properly. I just felt a bit spaced out. I went to A&E. My colleagues there were lovely. They just felt it was a viral illness and I should go home. Given the situation with ventilation, PPE, what have you, we later established, according to the WHO diagnostic criteria, that I had probable COVID both in March and October 2020, despite having negative swabs. But in A&E, my lymphocytes were down, which is indicative of a viral type of infection. I attended A&E 2 more times though after the 31st or the 1st of November 2020. The second time, again, I just felt absolutely terrible. I thought I was septic, so bringing an overwhelming infection. And because my swab was negative and my bloods looked okay, I was sent home. Interestingly enough, that second time, I recall that when cannulas were put in me, so fine, thin, flexible tubes into the veins, it took several attempts, 6 or 7 attempts to pop the cannulas in. And each time they clotted, which is not normal, but my brain was, I just wasn't right. So I tried to say, well, just try again. They eventually got blood and managed to get the cannula in, but this puzzled me. And the answer to that came a year later or so, why this probably happened. I returned to work after a few weeks, and after about a week or so, I felt like collapsing at work, only an hour into my A&E shift. My colleagues saw me and felt I had POTS. I felt I had long COVID, and I should go home. I was quite unwell, so for a number of weeks, I couldn't get out of bed. My left leg, it was weak. I struggled, for example, even to pour water into a glass and take it to my hand and take it to my mouth. I just wasn't able to. My other half didn't understand what was going on and just said, oh, you maybe just have this post-viral thing, please rest. But I was really worried. I also wasn't able to function, so cognitively, I found it really, really difficult. somebody might be at the door, but I'd be lying or sitting on the sofa for maybe 8 or 10 hours a day, while my other half had left me some food, some water, what have you. And I was just staring at the wall for 8 or 10 hours, not being able to do anything. My other half was concerned, but again, I was reassured it's a post-viral thing. It'll get better. I saw cardiology, who were great. They started me on Avabradine for my heart to calm that down. I had mixed feelings about seeing some other specialties who told me it's just a post-viral condition, nothing else, it will get better. Ultimately, that it's functional. And this infuriates me. I, as a doctor, know the health system. I waited, as everybody else did, but I managed to call up regularly to find it, can I have a cancellation? So if there's anybody who's cancelled, I'll get into that appointment. Otherwise, I'd be waiting a long time. I couldn't afford to go privately at the time. And I was really disheartened to have a person tell me, a medical colleague, that this was functional. So that it was in my head. So it might be the case that I'm anxious, I've overworked, and that CBT might be useful. Compared to then and now, neurocognitively, I'm much better. I'll follow on to that in a second. But as a patient who's vulnerable, who's ill, it's hard to debate or to get your point across when your brain's not working well. But I was told not to worry, these things get better. So that was late 2020. I saw a long COVID clinic, I don't know, March, April. They referred me to neurology. Neurology agreed I had chronic fatigue syndrome, ME, and probable COVID in the past. I was just relieved that somebody believed me. Even though I could say myself, these are the diagnostic criteria from the World Health Organization, to have somebody who listens to you and knows that you're not making things up was phenomenal. It was really acknowledging, validating. But I wasn't doing too well. So neurocognitively, I struggled. I was barely able to walk sometimes. On a good day, I might be able to walk at a push 1,500, 2,000 steps, but I'd be in bed for the whole of the week afterwards. That was on a good sick day. And on a bad sick day, I'd just be lying in bed and not able to process things. My other half was really worried. Family too. There was a pandemic. I wasn't ill enough to go to hospital. I'd raised concerns. You think, this must be in my head after all. And as a clinician, it's quite disheartening to hear this. There are various organisations to help doctors in such situations so they don't leave the NHS and to support them. I contacted one, I had some support from them, and they're lovely, they're really supportive. I saw a therapist, but ultimately I knew that pathologically something was not right. I've been in touch with other colleagues through the Doctors in Distress group, and I heard of Dr. Jaeger in Mulheim. I'd never heard of Mulheim before. I got myself on a waiting list and Dr. Jaeger called me. I remember speaking with her because I was ill for about 8-9 months and I thought nobody believed me.
So I think you covered a very common story that most of these people with long COVID who struggle for 8-10 months or even over a year have. And the sequence of all these symptoms that you discussed, I think, makes the problem of getting the right treatment for long COVID sufferers right, because it involves expertise in lung, in brain, in vascular disease experts, and these people somehow are not linked together under NHS. That's why people are being shuffled among different specialities, and there is no single expert who could identify the right treatment. So I'm really glad to know that you found a solution at a time. Yeah. So could you please talk us through the treatment that you discovered with Dr. Jaeger?
Of course, thank you. I'll just go back slightly and come back to this if that's all right. So my bloods in the UK were relatively normal. My D-dimer, for example, was normal. CRP, a marker of clots, for example, and infection, but it looked like I had a virus. And because of this, I was told, you've just got a virus. There's no other sign of anything else. And also, everything seemed to be psychologized. After a few months, I and thousands of others have been told it's in your head, don't do pacing, that's bad for you. Get on an exercise bike, try running. With a heart rate of 170 at rest, if I did that, I'd probably end up in resus, in hospital. So it's hard to find that understanding. And it was really disheartening. So I feel for everybody out there who is ill and who's had the same things going on. But when Dr. Jaeger called me, I remember just feeling so tearful. It was somebody who I'd never spoken with before, who I've heard of, who is now a friend. She listened to my story, she looked at my records, and she's told me, you have clots. And I thought, who is this lady to tell me that I have clots? My D-dimer is normal, my coagulation bloods are normal. I had a discussion with her, and everything she said made sense. Her background is she's an internal medicine consultant in Germany. She's also a specialist in lipids and lab medicine as well. So the perfect person you want, somebody clever that's going to dig deep if symptoms are still there, but the answers are not found. She said, you need to come over urgently. It's likely you'll have a fatal thrombosis, a clot, unless you get treated. And again, I'm not giving medical advice here. This was based on my individual circumstances. I don't advise that anybody goes out and purchases or somehow gets medicines like anticoagulants if it's not been told to them specifically by a specialist. It might be difficult to find a specialist in the UK who would advise, but I think it's really important to find somebody you trust to be able to then have a management or treatment plan. So I'm not advocating that everybody goes on anticoag. Okay. Due to some family issues and me being unwell as well, I eventually went over to Mulheim in Germany in November 2021. And when I saw Beate Jaeger, I just thought there was something about her, the interaction, the understanding, the sympathy, just made me feel I trusted her. I trust her. She looked at me and I was cyanotic. That means that my lips were blue, my peripheries were sort of blue, but my saturations of oxygen, so when you use a finger clip, were above 94. The day before coming to Germany, and this sounds really sensationalist, but I'll tell you, was looking into booking funerals or how much it would cost. I looked really terrible. I can show you a picture of me as I was coming to Germany. I was pale. People told me I looked really ill. The passport control officer even asked me if I wanted an ambulance. And I said, no, I'm fine. Inside thinking, I don't know if I'm going to make it to Germany. I felt really bad. I made it, and Beate started to treat me, initially with some anticoagulants. And I had 4 HELP apheresis treatments, which I can go on to in a second. After my 4th, because Professor Pretorius was here helping out in the study, which I collaborated in as well, she discovered that I had significant microclots and hyperactivated platelets. I was on anticoag and I had my 4th apheresis. They were still there. After my 5th apheresis, my samples looked like a normal control sample. So there were hardly any evidence of microclots or hyperactivated platelets. The day we discovered this was a really emotional day, thinking, so hang on, this medicine that Dr. Jaeger and the South African geniuses have suggested may work, seems to have worked. The HELP apheresis seems to have worked. Am I on the path to recovery? After my first apheresis, I think it was on the 2nd or 3rd of November, I could breathe properly. My brain was working. In the UK, I was seeing a neurocognitive specialist who was lovely, but I was doing brain training exercises and I just found it so hard. I couldn't process things. I thought really I'd be medically retired at the age of 40, 41. After one apheresis, I could function. I was speaking for 3, 4, 5 hours about scientific developments, and I'd not had this functionality for a long time. And I can't say anything else would have done that apart from Dr. Jaeger's treatment, including the apheresis. After my 5th, I said I had no microclots or platelets visible, but I had significant issues still with POTS, malaise, fatigue, really bad headaches. After my 8th apheresis, again, I seemed to go up a level in terms of function. And after my 12th apheresis 2, I felt better. I'm still nowhere near 100%, but I'm hopeful that with this treatment and relying on people who are pragmatic, who don't psychologize post-viral illnesses, who know how to look at biomarkers of clots, that people can get better. I know it's still new age stuff that we're still trying to understand, but the Pretorius Kell papers speak for themselves. The Dr. Jaeger papers speak for themselves. Our study in Mulheim, I hope when it's published, it will speak for itself.
So when you said that Dr. Jaeger was able to identify that you had clots, how did she do it?
Okay, apologies. I think you probably asked that and I just overlooked the question. So we had Professor Pretorius here at the time of the study and my bloods were looked at. So using a fluorescence microscope, which is quite expensive, using thioflavin staining, a centrifuge, slides, using the process that's described in the recipe, as it were, in the protocol that Professor Pretorius has written, she found these. They'll all be published in the paper that's coming out, but she found these. Otherwise, D-dimer, for example, I thought, well, how can you find clots initially? I mean, lab science for me was 15 or so years ago, but Prof Pretorius basically told me, well, D-dimer is just a marker of fibrinolysis. So the breakdown of clots, if it's absent, it doesn't really exclude the presence of clots. Mm-hmm. And the hypothesis, what they're thinking is that the S1 proteins, if you have, for example, a possible vaccine injury after an mRNA vaccine, mm-hmm. or if you've had COVID, the S1 proteins may persist. They're covered in the biofilm, mm-hmm. and you have clots surrounding that, and those might block off capillaries or end organs, for example, causing inflammation. Dr. Jaeger diagnosed me with an encephalopathy, so a brain inflammation, heart inflammation, which is not a myocarditis or pericarditis, but an inflammation of the vasculature, causing all of these symptoms. And it made so much sense. It was just so disappointing that I and several other colleagues and poorly patients have had to travel to Germany to be listened to and taken seriously. By no means am I saying that everybody with long COVID is in my boat, but everybody from the study in Mulheim who had long COVID had microclots identified, which is significant. By using these markers and maybe distributing them, educating the world how to use them, I hope that other people will be able to get the treatment necessary, whether it's anticoagulation or if they're worse, help apheresis. But I think this is crucial that we somehow educate the world in this.
Do you think that in this case, hematologists should play a key part in helping to diagnose long COVID and identifying the biomarkers appropriate to long COVID?
Definitely, and I think you've raised this for a particular point, which I thank you for. My GP's been brilliant. A number of specialties have been good, but they couldn't answer all my questions. When my GP had written to hematology, I was told, despite a letter from Dr. Jaeger stating microclots, hyperactivated platelets, the need for certain anticoagulant and antiplatelet drugs, that the hematologist told me there's no reason to take these drugs. There's no evidence that you have microclots or hyperactivated platelets, and that the combination is risky and that they will not see me. I felt slapped in the face. I saw them with my own eyes. I have pictures of them, thankfully. But even if I were to show them in person, if I, as a medical professional, am being met with a closed door, I imagine that thousands of people out there who have concerns similar to me are going to be met with a closed door too, especially if they're ill and they can't really advocate for themselves. Now my cognitive function is great, but this is so disappointing. To answer your question, yes, hematology should be used. I'd like to see hematology specialists helping to detect these clots. The microscope itself, the fluorescence microscope, can be quite expensive. However, people, as you may have seen on Twitter, have discovered their own microclots using cheaper student telescopes. They may not see the hyperactivated platelets, but specialist labs or labs collaborating with the NHS should be helping with this. I remember even forwarding my discharge letter to specialist colleagues and maybe having one response saying, wow, it looks like you've had a whirlwind of a journey. But because of the pandemic, everybody, I think my colleagues are trying hard. You know, they're dealing with patients, a vast number of patients, capacity issues in hospital, people who are really ill who might, you know, are not maybe getting the most, let me phrase this correctly, people who, because of the capacity issues in hospital, are not getting the most apt treatment because of the sheer volume of patients. You know, I'm sure my colleagues are not bad people. I'm sure they're trying their best. I'm sure they're working from the medicine that they learned. If we are to progress in medicine and in the treatment of long COVID, which to me looks like we need to detect microclots, treat them, unless we do that, then patients will come to harm. And we need to stop this psychologizing of people who have significant symptoms. There are children I know of.
So exactly.